everyone. For those of you who don't know me, my name is Ray Massey, and I am the Patient Engagement Program Manager for AST's Power to Save. It is my absolute pleasure to introduce our two speakers for today. We have here Mr. Rob Bennett, who's awaiting a pancreas and kidney transplant, who also serves on our Transplant Community Advisory Council. And we also have Dr. Michelle Jesse, who is a clinical investigator and senior staff psychologist at the Transplant Institute in Detroit, and the co-chair of our psychosocial community of practice.
Thank you, Ray. Well, hello, everyone. Hopefully, as we get started, some more folks can meander over. So today the talk is Preserving Your Sanity, Tips and Tricks for Caregivers, Recipients, and Donors. So I'm a psychologist, so obviously I'm going to be talking a lot about mental health needs, and some, hopefully some tricks on how to manage some of the mental health challenges that we face in the context of transplantation, what we typically see. So what's really important to always keep in mind, I didn't originally start in transplant. I actually started in cancer, but at the end of the day, every single chronic disease has a very different profile overall as far as its stressors, its setbacks, its challenges, but there is certain common themes. And so what's important about that is sometimes transplant candidates and recipients can feel kind of alone. And they think that people can't understand their experience, but ultimately those who, there are always going to be somebody who's going to want to understand your experience, and sometimes it's about reaching out to that individual. Now, that may be a caregiver, that may be a friend, that may be a coordinator. So there's a number of individuals that we should reach out to, which we'll talk a little bit more about that in a moment. So, organ transplant. I say organ transplant is a marriage. Once you get to this process, you are married to your transplant center. First there's the evaluation, which is kind of like the courtship. You start dating, you wonder, is this gonna work? Does he like me? Does she like me? And that's in essence what the evaluation entails. It's about getting to know each other to see if it's a good fit. Because sometimes it's not always a great fit, and that's okay when there's other transplant centers around. But ultimately it's kind of it's a courtship. And then after listing, you have the engagement. There's the excitement, there's the waiting, there's the planning, there's the hoping. And eventually there comes the transplant. And that is truly like the marriage. That is the solidification of that relationship. But what's important there to keep in mind is that any of us who are married know that marriages are work. We can't just show up to our marriage every day and expect it just to go smoothly. We have to continue to try to maintain that relationship, maintain that open line of communication, and continue to work together, because like any good relationship requires both investment if we're going to take out of it. And I don't mean that in the sense of what we take from people, but any relationship is a give and take. And this is the same thing within the context of organ transplant. And then I believe it was Dr. Gill or someone else said it yesterday, and because I say it all the time as well, transplant is a marathon, not a sprint. It does not just get over. It's not, I'm listed, I'm set, I'm good. No, it's a lifelong investment. To be a transplant candidate and recipient is for the rest of your life, and that's not a short stint, or we don't plan on that ever being a short stint. When we first were starting to talk about this particular talk, one of the comments that was made was that transplant candidates, recipients, and caregivers sometimes feel very alone. But you are never alone. Even if there's not a lot of people in your immediate circle, even if there's a lot of, not a lot of people that you spend a lot of time with, at the end of the day, once you are in the transplant spectrum, you are not alone. There is your coordinator, there is your nurses, there is your doctors. And the point of pointing that out is simply that with regard to ongoing mental health and self-care, there are individuals that are always worth reaching out to. There's a beautiful woman up there. Her name is Beth Rubenstein. I want her to see this video at some point in time. She's an exemplary example of exactly what I mean. She is a transplant recipient at my center, and she has run something called TLC, the Transplant Living Community. And in essence, she has created an entire community of transplant recipient volunteers whose sole purpose at being at our center all the time is to provide support and education for our transplant candidates throughout the transplant process, and to help them learn about lifestyle management after transplant. And so to me, she's just a fabulous example of someone. There just are people out in the world, maybe they're not in your immediate community, but there are people in the world who care, who want to know that transplant recipients are doing well, and if they're not, or if they're struggling, that there are things that they can do to try and help. So what can we do? Well, at the end of the day, again, I'm a psychologist, so, and I'm sorry that kind of cuts off a little at the bottom, but I'm a psychologist. And so I'm very interested in the brain in particular. And there's some really interesting things that the brain does. The human brain has a lot of shortcuts, and a lot of those shortcuts are not necessarily always helpful to us. In some respects, it makes, it's kind of like it makes the brain's life easier just because it's processing so much information at once. But it can get into these sort of traps, into these little errors that we have to be mindful of. And so what we call them is cognitive distortions. So in other words, they're types of thinking that are these little traps that our brains can get into, and they're not helpful to us because they're not necessarily reflecting the reality of our experience or the situation. So these are some cognitive distortions. And I always kind of reference adolescence because they just are such good examples of cognitive distortions. So one very common one is all or none thinking. So, Sue desperately wants Tommy to ask her to the prom, and if he doesn't ask me, my life will be over. Well, will your life really be over? No, your life's not going to be over. Overgeneralization. So one negative event is a never-ending pattern. I got that 1B in high, again, I'm using adolescence, but that 1B on my GPA. My GPA is now 3.9. It's just that 1B, that 1B, that 1B. So fixating on that one thing, that one negative thing, and then just sort of overgeneralizing it across things. Picking out a single negative detail and dwelling exclusively on it. I like the example of going to a theme park for a day with a bunch of friends, and the day is awesome, and you've been on roller coasters and everything else, but lunch stunk. It took forever, the fries were stale, it was cold, and when you leave, all you think about or care about is that lunch stunk. So you missed out on the whole great parts of the day because you were kind of fixating on this negative side, which really kind of took the joy out of it. Disqualifying or rejecting the positive. No one comes into life necessarily thinking, oh, I want to get a transplant. But I always like to emphasize in the context of the world we work in that, at least we have transplant. When you look at medicine in general, even in the last 100 years, look at my field, look at mental health. 100 years ago, we were drilling holes in people's heads to let the demons out. Literally. Maybe a little more than 100 years now, maybe more like 20 years now. But 120, 130 years ago, we were literally drilling holes in people's head to try and help the demons escape. So, clearly we've made some progress. So at least there are these medical options, and sometimes it's easy to forget that and disqualify the positive in the context of that. Jumping to conclusions is another one. I use the example of your spouse comes home, they're crabby, they're short with you, they're just not, and they go up to their room and they just go to bed and they don't want to talk anymore. And oh, he must be mad at me. Things are bad. Oh, goodness. Well, no, he had a bad day and he was being a crank. The fortune teller. Now, the fortune teller is interesting because thinking automatically, there's two phases to the fortune teller. One is thinking that, everything's going to turn out badly no matter what. It doesn't matter what I do. It's going to be bad. It's going to be bad. But sometimes some people, too, get into the next phase of the fortune teller, which is if I just think about all the bad things, I can keep some of those bad things away. But the truth of the matter is that's a kind of magical thinking that isn't really accurate. Emotional reasoning. I love bringing up emotional reasoning with transplant, and I bring it up a lot in a lot of post-transplant therapy because a number of transplant-related medications induce physiological symptoms that mimic emotional symptoms. So steroids. People who've had a transplant have had steroids. They can feel agitated, they can feel irritable. A woman yesterday said she felt like she was losing her mind, and she doesn't like the steroids. And the way the brain works is such where sometimes there are physiological emotions, and then the brain gets those emotions and interprets them and thinks, oh gosh, I'm feeling tension in my chest, my breathing is short, my back is tense, I must be anxious. What am I anxious about? Oh, here's all the stuff that I'm anxious about. But the brain does it in like a tenth or less of a second. So in other words, this isn't necessarily conscious thought. It's just that you feel anxiety and suddenly you're anxious. Not because, again, so being able to recognize and differentiate some of those emotional reasoning in the sense of how I'm physically feeling in the context of how I'm thinking. Shoulda, woulda, couldas. Shoulda seen the doctor sooner. Shoulda called the nurse sooner. Another word for this is retrospective bias. We can all look at our past and say, I wish I wouldn't have done that. I wish I wouldn't have made that decision. I wish I wouldn't have gone there. But really, what does that accomplish in the present moment? Now, the alternative to that is looking back and thinking, if so one thing is looking back and saying, I wish I wouldn't have. I shoulda, woulda, coulda. Another way around that is it's okay to look back at past choices and behaviors if we think of it in the context of, if I interact this way again with someone, or if I come across this problem again, what would I like to do differently next time? So instead of necessarily ruminating on the past experience and just sort of, I shoulda, I wish I could have, I would have, but instead translating it into future choices, that becomes more empowering. And judging. One of the biggest themes I come across in a lot of my therapy patients that I see post-transplant is they can be very self-critical. Transplant's very demanding on our patients. It's very demanding. A lot of what I'm talking about, I'm preaching to the choir as far as the level of medications, the self-care. I mean, we just heard a great talk about some of the lifestyle-related requirements in the context of travel and medical intervention. And so there's a lot of demands on patients. And so it's not uncommon for me to hear patients say things like, I should be handling this better, or why am I not better organized, or I can't seem to get this together, or I should be happy that I got a transplant, and I'm not. And really that self-judgment, that constant negative self-reflection can be very harmful to an individual's ongoing well-being. It's very easy to judge oneself, and we're going to talk a little bit more about emotions in a moment. And I love this. This is one of my favorite expressions. It's such a mental health expression. Don't believe everything you think. It's true. Don't believe everything you think. Now, I know this is kind of an eyesore, but I like to talk about this because, and maybe, do I have a little, oh, it doesn't give it to me. Okay, so I'm going to explain it as best I can. This is what we call the inverted U hypothesis. And this is an old hypothesis. But in essence, what this is showing us is that there is one of the themes I want to get across. There's a couple of themes I want to get across. One I've already kind of said. One, you're not alone. You are never alone in transplant. I mean, you're here. That's evidence you're not alone. Two is that all negative emotions are not necessarily bad emotions. And so this is a good example. In other words, there is healthy anxiety. Anxiety can be a very positive motivating factor in the right amount. And that's what this slide is basically saying. In other words, if you look at this, and again, I'm sorry, but so over here on this side, with the slower side, so thinking again, I like the college student, because I used to teach undergrads. So if you've got a college student, and he's not really anxious about an upcoming test, he's not worrying about it, he's not anxious about it, he's not thinking about it, well, he's not studying for it. And so he does poorly. The other end of the spectrum is the college student who's so anxious, who's so feeling overwhelmed, their anxiety is out of control. Well, what that does is that blocks that individual's ability to really process the information. The brain can't necessarily take that information and store it because it's too anxious. And so the point of this slide is that there is a healthy level for optimal functioning. In other words, there's some anxiety that's good. It motivates us. It keeps us going. It keeps us in our direction that we're trying to go. But it needs to be a manageable level. And that's something about knowing how you work and how you perform in the context of your care. I use the example in the context of transplant that some people like to know everything. They want to know their labs values. They want to know every medication and side effect. They want to know the schedule 7 months to 17 years in advance. They want to know every little minute detail. They want the doctor to say they're doing well or what they need to do differently. And they're very, very sort of, they like that detail oriented. And other individuals do really great, but they don't want all that detail. Like, just tell me my labs are good. Okay, these are the medications I need to take. Okay, good. So knowing how you function in the context of your medical care is really important in this context. So now again, though, anxiety can get away from us. Now, little anxiety is not in and of itself bad. It can be a motivating factor. It keeps us motivated, it keeps us going, it can keep us focused. But it also needs to be well managed. It needs to be addressed. And so mindfulness meditation is it's got a lot of attention. It's really amazing some of the research that's come out. And basically it helps with sleep. It helps with anxiety. It helps with depression. It's just been helpful. Chronic pain. And so basically mindfulness is a moment that you intentionally, at a certain period of time, where you intentionally take a moment and you pay attention to yourself in a non-judgmental way. You calm your body, and you, in essence, take a moment just to be aware and accepting of yourself in that moment. If you've ever seen Eat, Pray, Love, she's a great example of how hard it is to meditate, to do mindfulness. She's sitting in this room and her mind is going ping, 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 ping. And she's not really, and then she looks up at the clock and it's been 3 seconds and she really hasn't cleared her mind. Meditation is simply taking a moment to clear your mind and to not be judgmental of oneself or one's thoughts. Accept thoughts that come in. If they come in, let them go out. Acknowledge them, but let them go out. And have a moment of being aware of the body in a calm, relaxed state. If anyone's interested, I have some resources that go into more detail. But what's really important, and I'm going to reiterate a few of these things, is, again, it's about non-judgmental, calm moments in time. And let me tell you, your doctors are using mindfulness. Like your doctors are using this now. Your surgeons are using this now. They're applying this in their clinical practice. Just the other day, I walked into the nephrology workroom and I saw the nephrologist and she was like this. And I tapped, I was like, and I was like, Dr. Corey, and she popped up and she's like, oh, I was just meditating. I was like, oh, I apologize for interrupting. So this is something, like I said, it's not, and we're not talking about monks in the caves and for 4 months at a time, but research is showing that even brief mindfulness-based interventions are having significant impact on how our brains are not only functioning, but how our brains are structured. So an important element of mindfulness, but in general, is acceptance. This is one of the other big ones that I run into a lot in therapy, and again, this relates to that judgment. And the difficulty with accepting what we consider to be bad emotions. We like to be happy. We like to feel contented. We don't like to feel stressed out. We don't like to feel angry. We don't like to feel sad. But there is nothing inherently wrong with feeling angry. There is nothing inherently wrong with feeling sad. But it's what we do with it that really is very powerful. So sometimes it is the appropriate thing to feel sad. When we lose a loved one, we should feel sad. There's nothing pathological about grief. And a lot of things that happen in the context of transplant are grief. Loss of autonomy, loss of independence, loss of aspects of our health. So in the context of this, like accepting what can be difficult at some times can be very powerful. Now, I'm not talking about some of the more extreme symptoms, and I'm going to come back to them. But in the sense, what I find a lot, like I said, is individuals really struggling with not accepting themselves. And not necessarily, they're accepting their transplant, they're accepting the status they're in, but they are not necessarily can be very judgmental, self-critical, and not accepting what they're fighting against their negative emotions. And oftentimes that just gives those negative emotions more power. Fighting against the anger, rather than coming to terms and accepting the anger, fighting it really can attenuate it in many cases. So acceptance can be a very powerful instrument in maintaining long-term mental health. Okay, sorry, that kind of cut off, but I'm also, more and more research continues to come out on gratitude and the importance of gratitude. And I love this because, I love Bing Crosby. If you're worried and you can't sleep, just count your blessings instead of sheep. And the reason I bring up gratitude in particular is, again, research is coming out more and more often that just thinking at the end of the day, 2 or 3 small things that you're grateful for, can have a really huge impact on your mood and your mental health. They don't have to be big, elaborate things. They can be, I'm grateful I still have my dog. I'm grateful that my comforter is clean. These little things can have a really significant impact on your mood the next day. They can help with sleep. There's just a lot of things that they can do. And practicing gratitude, it's just, again, the impressive power of this is really coming forward more and more in the research. So I'm going to let Rob talk about this part. I just want to point out just 2 things. So this is if anyone's ever taken a psych course in college or looked at something up in college in this, so this is Maslow's Hierarchy of Needs. And I think that in transplant, oftentimes we get very fixated on the bottom 2, but I'm going to let Rob talk about finding meaning and what meaning can mean for you.
So I've always looked at pyramids in a way that, yes, they are physically balanced and stable, but not always accurate. And a box or a circle is usually a little more appropriate for most things that affect your life. So physiological needs, everyone has physiological needs. We need to eat, we need to sleep, we need water, but different people have different needs. Some people need more, some people need less. So with the safety needs, it's another one. Everybody's got to have safety and comfort and a place to live, but one person needs a 10,000 square foot mansion and a closet the size of this room, and other people can be in a loincloth, a Bowie knife, and a tarp, and be completely comfortable and happy with themselves, right? So I'm kind of the weirdo. I'll fall in between. I don't like, anyway, you don't want to see me in a loincloth. But with love and belonging, this is where it starts getting a little more gray. Because as you start going up the pyramid, each one of these lines can mean a little something different to everybody else. So with love and belonging, it can mean family and friends. It could mean a dog or a cat. I believe that you need to start with love and belonging with just yourself. Begin by believing in yourself, loving yourself, and understanding you're here for a reason, and the fact that you're standing here right now is a miracle. Whether you believe in religion, science, a mixture of the two, or you believe in nothing, it's still a miracle that you're here, floating on this little ball in space, speck of dust, but you're here able to do what you're doing. And if you can have a large circle of friends and family and people that can support you, that's fantastic. It helps. But it's not always the answer for everyone. Esteem is kind of tied directly into that. You need to have some self-esteem. You need to have some belief in yourself and recognize your strengths and your ability to do things. And sometimes people dwell on the past. Sometimes people dwell on the future. And that's all fine. You can find a balance in all of that, but you really need to live in the present. So what you were 10 years ago, before maybe you got sick or before you had a transplant, may be completely different. Before you had to take care of somebody as a caregiver, might be completely different. So right now, your needs are immediate. The future may bring what it brings. There may be a glorious future where there's a cure, everybody's happy, you don't have to do anything hard anymore, it's great. Or it could be something that's even more challenging than what you're dealing with now. But who you are in that moment is going to be who you are. And if you dwell on the negative aspects, you'll never be able to enjoy what you have at this moment. And so that brings self-actualization. You have to be able to realize who you are, what makes you tick, what makes you happy in life. And not just, I like to sit on the beach, I like to drink Mai Tais, little minuscule things that maybe you think at front of your brain is who you are, but what you really enjoy for your capabilities at this moment. And for me, self-actualization is not a hard thing. I like myself. I know who I am. I'm no different than I was 20 years ago, no different than I'll be 20 years from now. Doesn't matter what happens to me, I'm always going to be the same person. I might be in a wheelchair, I might be Superman, it doesn't really matter. I'm me, and the self-actualization is really truly what defines life. In any scientific journal you read, what really defines life is the ability to acknowledge that you are on this planet and you are who you are. And that's the best thing to be proud of, is being able to self-actualize, have the esteem to work through your life, enjoy it, love yourself, and then spread that. And honestly, some people, if what you love is just sitting in front of a TV and not having anybody around you and being introverted, awesome. If you want to be extroverted and go out and scream to the world what you are and who you are, awesome. There's nothing wrong with anything that you're going to be thinking about. Just always remember, you're never alone. Your life has meaning, and it is what it's made of. And so find what you love, find what you like, do it to the best of your capabilities. And this is a great venue for that, because you may not have thought you could have run a 5K, but you did. You got a silver, you got a gold. You may not think you can play table tennis, and all of a sudden you realize you're Forrest Gump. Awesome. Just have fun with it, Life is the way it's lived, and the best way to have a good outlook on life is to just realize that and don't dwell on what could be or should be or was or is. Just live in the moment and knock down those barriers that give you the negative thoughts in your life without being unrealistic. You want to make sure you're realistic and critical thinking, but also not dwelling on those negative aspects, the things your brains are going to trap into your mind. Just let it all go and just start fresh and have a good outlook on what you're doing. and just be you. Because honestly, no matter if you're a caregiver, a donor, a recipient, wait list, you're all superheroes. Everyone in this room is a superhero in your own right, and take pleasure in that. I mean, I've had diabetes since I was 9 years old. I know what it's like to have sacrifice, be limited in certain things, but I don't dwell on it, and I take the things I am good at and that I can do that I enjoy, and that's what I do. And after I have my transplant, it may change, it may not change, but that's okay. So, thank you.
Thank you, Rob. That was great. That's why I like Rob doing that slide. He does it so well. He really does.
Thank you.
I think he just touches upon so many good points about being in the moment, about knowing oneself and your goals and your aims and what's important to you in your life. And I think that is really the ultimate point. So sometimes I think one other thing that often folks struggle with in this context is knowing when to say no, or knowing that it's okay to say no. So I'm going to give you permission to say no. It's okay to say no sometimes. Guilt is another normal human emotion. We are social animals. We feel an obligation and a responsibility to each other, whether we like it or not. But it's okay to say no. So my personal favorite, just because I have I do research on top of my clinical work, and so it's not uncommon for one of our surgeons to come by, and I jokingly call it a drive-by research project, and he will be like, "Ooh, I've got this great idea. We should do this," and I'm like, "I am so busy right now. I'm like, "Ooh, you know what? We should put a pin in that. Let's put a pin in that," and that's my way of saying we're not doing that, without necessarily saying we're not doing that, but because he's going to forget and move on and whatnot. But if he really is passionate, we can talk more about it. But at the end of the day, it's okay to say no, or it's okay to say maybe, and then think about how you can say no. That is something that some people do struggle with. Some people have no problem with it at all. Honestly, I think Rob probably has no problem with it at all.
No.
No. He has no problem with it at all. But some people genuinely do, and I think that that's something we can all practice when we have a discomfort. Again, learning how to be comfortable with some of our uncomfortable emotions, or at least accepting some of our uncomfortable emotions in the long run, can actually create a lot of benefit for us and protect us. And so it's okay to say no sometimes. Not saying you have to say no all the time, but again, you have permission to say no sometimes. So I always bring this up because this is, at least some portion of my job is spent, and I do things wrong sometimes. Don't misunderstand what I'm going to say. I make mistakes. I say the wrong things. I make the wrong steps. And my point being is that, I do end up sometimes having to interject or intervene where there's an issue between a provider and a patient. That's going to happen. People are going to disagree. People are going to make mistakes, or they're going to say the wrong thing. And the reason I bring this up is that providers are people too. And they do care. Every morning we get up and we have one goal in mind, and that is to keep our patients around as long as physically possible and keep them around well. Keep them awake and functioning and walking and living their life. We don't do this because, yay, we do love it, but we don't do it just because, for the money or other reasons. We do it because it's genuinely our passion. We genuinely got into this field because this is such an amazing place to make a real impact on people's lives. It's such an honor on a regular basis, and there are days where I come home and my husband will say, "How was your day today?" And there are bad days, don't get me wrong, but there will be days where I'm like, "I think I made a difference today. I did something today. I helped someone." And that is the best feeling in the world. That is why we get up every morning. And even when our providers, and I'm putting myself in that camp, I say the wrong things sometimes. I misstep. My intentions are always good, though. And my point being is that remembering that when, maybe your doctor is driving you nuts, or or the nurse was a little shorter than you would have liked, or things like that, they genuinely care. And so my point of bringing that up is not to make excuses for when individuals say things that they maybe shouldn't say, or maybe they misstep, but the point being just that they make mistakes too. And they are they are doing the best that they can. And so remembering that they genuinely care sometimes can calm you down as well. It's not, I definitely run across some individuals where, again, holding on to anger is one in particular. An expression I really love is holding on to a grudge is like drinking poison and expecting the other person to die. And it's true. It's completely true. So, sometimes just taking a moment, and this is true of any kind of conflict or interpersonal difficulty, if you can take a moment just to put yourself in the other person's shoes for 1 second, sometimes you just get enough insight to be like, ooh, I'm mad at you, and I really don't like what you did, but I'm okay with that. I'm not going to hold on to that. I'm going to let you know, maybe, but I'm not necessarily going to let that impact me negatively in a long-term way. And that's really what it is. It's, again, if you're going to carry something around in you, you're ultimately poisoning yourself. You're not necessarily hurting them. And some people, that's a real struggle. And again, in the therapeutic sense, sometimes that's a topic that comes up. So we're going through kind of fast today. I don't know if I'm not saying as much. So I've talked about accepting negative emotions. I want to talk about the other end of the spectrum now. There are times where negative emotions they need to be intervened, that we need to do something because the negative emotions have become such where they're hurting you. Okay, so if you are sad for a day because you had a bad day, that's okay. But when negative emotions get out of control, when they get away from us and they really start to stick around, that's when we need to reach out for help. So here are just a few things. Now there's others, obviously, but here are just a few things I want you to keep in mind. If you feel for maybe 2 weeks or more, if you feel like you've just lost interest or pleasure in doing things you used to enjoy. Okay, I'm not talking about I have to go to the store because it's my chore, or I have to do the laundry because I have to and I don't like doing it. That's not what I'm talking about. But let's say you have a hobby or an activity, you're in a bowling league or anything like that, and if you just don't want to do something that you've previously enjoyed, that's a red flag. If you feel hopeless and you just feel like you can't shake the mood off, you're down and blue and you just can't, and maybe you're doing everything you're supposed to be doing, but you just feel down, that's another red flag. If you feel like you're anxious or nervous most or all of the time, and especially if you feel like you can't control it, you can't get ahead of it, then no matter what you do, you're feeling anxious, you're feeling nervous, and you just can't seem to stop it, that's a red flag. If you have any thoughts about ending it all, that it's just not worth the fight anymore, I don't want to do this anymore, I'm over it, I want it all to end, that is a big red flag. So in those situations, I want you to reach out to someone. And I don't have a personal preference, but here's a few people you can reach out to. Talk to your PCP, talk to your primary care or family provider, or another healthcare provider. Call your coordinator. Your coordinator should have a list of individuals or a number of individuals they can refer you to or recommend you seeing. Find a good therapist. I'm a huge proponent of therapy. Obviously, I provide therapy. But the way I look at it is like there's a stigma in mental health. There still is a stigma in mental health, which is really unfortunate because it happens to a huge proportion of the general population. But therapy is also approximately 1 hour a week where you get to go and talk to somebody whose job it is to listen to you, whose job it is to just be a sounding board for you. And family and friends are wonderful. I'm not trying to discount going to a family or a friend, but sometimes, they have their own agendas, they have their own thoughts about things. This is somebody who's trained to recognize those cognitive distortions. They have more of an ability to be objective rather than having some of those subjective influences. And like I said, it's an hour a week where you get to talk about you. I'm not gonna lie, I have been in therapy. I love therapy. But a couple of provisos about therapy though. One, find a good provider. Do not necessarily, just because you go to therapy does not mean the first person you see is the person for you. You find somebody you click with. You find somebody where you find that relationship, that cue. It's kind of, I don't want to say finding a soulmate, but it's somebody that it just makes sense with. You find that person. And if the first person it doesn't feel right, I always refer to this, one of my mentors, who he's very abrupt and he's a bit harsh. And for me, that would be good in therapy. But for my mother, who's a little more anxious, that would be terrible in therapy. I would never send her to him. And so that's just it. Like people, different therapists, just like different hepatologists and nephrologists and pulmonologists, they have different styles, so do different therapists. So my point being is that at the first therapist, if after a couple of sessions you're just like, I don't know, this doesn't seem to be, I don't know, I'm not feeling this isn't working, then find a different therapist. Now the other side of that is if you find somebody you do like, don't get dismayed or feel like you need to pull back when they start to challenge you, because they will. Once they've developed a relationship with you, they're going to try and push you, but they're doing it to help. At that point, once you're comfortable, once you've gotten that relationship, they're going to push you. That's a little different. So like I said, find somebody you're comfortable with. Don't worry if it takes 2 or 3 providers. But once, and then once you're in it, like I said, they will push you. And that's a good thing. That's what we all need sometimes. Go to the Power to Save Facebook. People are on there. Reach out to people on the Power to Save. Reach out to another social media forum, or if there are support groups or other social forums. Reach out, phone a friend. If you feel comfortable enough, phone a friend. They'll probably direct you to the first 3 bullet points, but the point being is we don't want you being quiet if you're struggling with your mental health. And if you do get to the point where you've got, again, if you do get to the point where you start thinking, I don't want to do this anymore, I don't want to fight anymore, I'm over this, I just want to end it all, please immediately call someone, and if nothing else, there's the National Suicide Hotline. Because at the end of the day, suicide does more damage than good. It just leaves a horrible, horrible negative effect on people. It ends up hurting a lot more people than it ever helps. Sometimes people who have attempted to suicide say, I just thought everybody would be better off without me. And that's not ever the truth. That is never the truth. So remember, you are not alone. You are allowed to ask for help, and you should ask for help. And there are always options. So always remember, you are not alone. You are allowed to take care of yourself. And that is very important. And not just physiologically speaking, but mentally speaking as well. And so now I'm going to go to my plug. So I am the co-chair of the Psychosocial Community of Practice. And for those of you who've had caregivers, you may have noticed that online there's not a whole lot of resources for caregivers that are a comprehensive resource guide. Well, we want you. Please, I need caregivers, please. So we've got this great panel of experts. We've got, again, psychologists, psychiatrists, pulmonologists, you name it, all these experts in our fields. But we need caregivers because we want to create a living document that really gives caregivers the resources they need and want about the transplant process. We don't want them feeling alone any more, than anyone else. So if anyone is interested or knows of a caregiver who would be really great, I've got a little sign-up sheet at the bottom. There's also my card. If you've got a Gmail account, it's going to go through my firewall. So please write down your email, and I will definitely send you an email. Or reach out on the the Power to Save Facebook page, because again, just like donors and recipients, caregivers need our love and support as well. So that, I believe, concludes our presentation. Is there anything you'd like to add, Rob?
No, just remember, you're not alone. You're a great human being, and you deserve to be here. So,
yeah. Thank you all for coming. Say, Ray, do we have any questions, or is everybody pretty happy? We have a question.
This thing on? Yep. Oh, okay. Going back to your point of saying no, I'm personally the kind of person that has the overwhelming feeling to say yes to everything, whether that's helping someone fix their car or going to a party or whatever it is. Do you have any exercises in those moments when people are asking me things to break that thought pattern of having to say yes?
Interesting. Well, think about it like you go to the store or you're going shopping for clothes. Okay, think about it that way. So there's gradients of commitment, if you will. So in other words, I'm getting a T-shirt from Target versus I'm at the Armani Exchange. So one of it is being aware of your natural reflex to say yes, and working up to saying no to the bigger things. So in other words, when you're in the Target analogy, and the T-shirt, no. So in other words, let's say somebody says, oh, can you just send a quick email for me? Gut reaction is yes. Okay, I can't do that right now. So in other words, kind of just identifying maybe if there's smaller things, because sometimes it's funny, it's kind of inverse. Sometimes the smaller things are actually, sometimes the bigger things are harder to say no to. Like your buddy needs your help moving, and he needs your help, and you're like, oh, that's a whole day or 2 days of just physical labor, and so stuff like that. Sometimes, but that's the real time commitment. That's the real personal investment. But he needs the help. That's harder to say no to than say your buddy's like, hey, on your way over, can you pick up some chips? And you're already like a block over, and then versus going back to the store, kind of a thing. So one of the things that you want to think of, and being aware that that's your natural gut reaction, is finding those sort of more of those t-shirt moments initially and building that up. And again, as parents, we always say, pick your battles. Mm-hmm. So I mean, if it's genuinely you're in a rushed moment and you've got a kind of a t-shirt example, like, more that somebody's like, oh, can you send out a quick email about this? And you're busy, it's about, okay, this is a moment where I can say, ooh, I'm really busy too right now. I can't do that right now. And it's a small thing. And then realize you might feel a little guilty, and that's okay. Just say, okay, I know I feel guilty now because I said no, but it was good I said no. It's good I said no because I'm busy too, and my time matters as well. And my time is also valuable. And if I could help, I would, but right now, I've got stuff on my plate. Because that in the future there's going to be times where maybe that person's crazy busy and you're just sort of, do on Facebook or whatever, and you can send the email. So practicing with those smaller, kind of picking your battles things can warm you up as you get closer to the bigger things, and then you get, it's not that you ever have to say no to your buddy, but, maybe at some point when he does want you to help move apartments and your wife, she has other plans for the weekend. And so, so sometimes it gets to the point where, you can think, by then you'll have a little maybe more confidence and understanding of how you process that. So if you need to say no to your buddy when he does ask you for those big things, you can have a little more confidence and recognition and sort of self-feedback that, you realize your time matters as well, and that we just intrinsically do spread ourselves too thin, and there are times when we can help, and there are times when we can't, and that's okay. So, like I said, wade your way into the water.
And if you can, take time, and you have time to be introspective as well as understand their shoes, their point of view, and why they asked you in the first place, don't be afraid to say yes.
That's true too.
A lot of no's become yeses, a lot of yeses become no's, and sometimes you say no and it works out to be better for the person that asked you. Sometimes you say yes for something you don't want to do and it turns out to be one of the best yeses you ever made. So you really have to pick your battles. Think about it from different perspectives and try and understand where they were coming from when they asked you, and hey, am I going to enjoy this? Is this friend of mine going to be enriched because of it, and will that make me a better person if I do it? And as time goes on, and the more you say no, and the more you say yes in the right situations, you'll understand when and how to say no more effectively.
Mm-hmm. Being more selective.
Can I throw a very left brain approach to that? Is the most valuable resource I think any of us has is our time.
Yes.
But most people, when they think of resources, think of money. And what am I willing to give up to buy this right now? And what am I not going to have time for because I said yes? If I say yes to you, who am I going to have to say no to? And kind of thinking of the time as a resource, at least for me, made it far easier to say no when I needed to and let me say yes more happily when I could.
Absolutely right. Absolutely right. Time is absolutely right. Time is a very precious
and
resource.
especially folks like us that have chronic illness, you may say yes, you enjoy it, you help the person, everything goes great, but then the next person asks you something, you also want to do that, but then you're too tired or you're too sore from the previous event. And then you have to, again, be introspective and think, okay, next time, let me try and think about what could happen the next couple of days, because I might be laid up for a day or two after doing this one thing. And you have to know yourself to be able to do that.
Oh.
Okay, I don't know if this is a question or a suggestion, but among the many people gathered at this event, there's a couple of hundred living donors.
Yes.
And I donated 16 years ago, and I work a lot on the internet with sites where people, living donors, share their experiences and problems, and potential living donors want to ask them questions, what it might be like. And it seems that the psychological health of the living donors is sometimes neglected. I remember the first time, I had a very good experience. I remember the first time a living kidney donor shared on the site that he suffered severe depression, even though the transplant was a total success. And I was surprised because I'd never heard of that. And suddenly, bang, 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 6 or 7 others jumped in and said, me too.
Yeah.
And many had said they had never shared that with anyone because everyone expected them to be full of warm, fuzzy feelings, and they were ashamed to admit. And the few that did approach their hospitals, it was just a brick wall. You know, your incisions are healed, your remaining kidney is working, so
You're fine.
we don't care about.
Yeah.
So I think any good transplant system in a hospital, I hope, would not only carefully follow up the emotional and mental health of the recipients and their problems, but don't presume that the donors are just fine when they're sent out, that they may have problems dealing with that tremendous experience, particularly with depression. It seems to be common enough that it should be on the warning list for potential donors as a possibility, because many were just blindsided. They had no idea that they would be hit by that. So I just want to throw that in.
Thank you. No, absolutely right. You know, I try to make this general, but thank you. You bring up a very important point. We do, you know, there is literature that shows that donors are at increased risk for depression and other psychiatric illness after donation. And I'm not talking schizophrenia, but I'm talking anxiety and depression. I will tell you that, and this was before my time at my center, but we did have a donor suicide. And that really knocked everybody off their feet. And and now at my center, every donor I see, that's part of the informed consent, in the sense of, just so you know, some donors struggle afterwards, and we're going to follow, and so we have a protocol in place. It's not as aggressive as we'd like because we need more people. We're working on that. But I think you bring up a very, very valuable point. And I think that at the end of the day, our donors go through such an intensive evaluation, and they are so healthy, and then you're right, it's kind of like after the fact, we're like, okay, you're good, all your labs are good, okay, go do tra-la-la. And at the end of the day, every human being has their own unique risk for developing mental health issues. Some of us have lower risk than others, but living donation in and of itself might be a risk factor. In some cases, it's the individual has a risk, and living donation is a stressor. We're still trying to understand that from a mental health standpoint, but that is a brilliant point, and you're absolutely right. And again, I get a little down myself when I hear people struggling with mood and emotional aspects and reaching out to their centers, and the centers being like, you're fine, your labs are good, go shake it off, or go on a vacation, or some sort of just dismissive comment. Nothing just absolutely hurts me more, quite frankly, and that's why I love where I'm at, because we don't do that. So I think that you said you were your onliner in some sort of forum, and so you are a great example of what we, a peer mentor, and being someone who doesn't dismiss that. And I think that's what, getting back to the therapy context and saying, there's a stigma with it. And when we as healthcare professionals perpetuate that stigma, that's awful. That's just, to me, drives me batty. And so, but when there's other individuals who don't perpetuate that stigma, but instead acknowledge that, that's powerful. And so I commend you for that. And yes, be that ear, and encourage them to find other individuals who will be that good ear for them, because nobody should have to suffer in silence. That's just never okay with me. So thank you.
I see it as a battle between the heart and mind. Your heart did what it wanted to do, and you were fighting your brain the whole time, because your brain's like, no, I don't want to give something away. But your heart's like, I want to give something away.
Yeah.
And I want to give this gift. And, you can think about it even from a smaller perspective of, say you have something that you really enjoy that you have, and you lose it, or something forces you to sell it, like a car or whatever, something you've collected. You can even relate a small sense of that grief of loss for something that's inconsequential and means nothing, but your brain is telling you this is major. And so when it comes to an organ, your brain's screaming at you like, this is major. And you're trying to break down those walls again, like many of the slides presented, that you have to retrain your brain to listen to your heart, and you made the right decision, and be happy with that decision, be happy with yourself, and understand that, did you really lose it and regret it? Or is it just your brain tricking you into thinking that? And I think you obviously have a great outlook on it, but other people may have a little hard time finding that, so getting help to understand that losing something is okay. You can lose things and life goes on, and you can still be who you are.
All right.
Thank you.
Thank you, everyone.